So, you need some of that health care. There are a few common organizations that you may have interacted with as your entry into healthcare: primary care, urgent care, and emergency departments. In this video, I will discuss the differences and strengths and weaknesses of each. These are not all-encompassing or definitive. This is meant to be a gross oversimplification of a potentially complex topic. Primary care. Some of the advantages are that it often has a lower cost. If the labs can wait, I'd rather pay for primary care than an emergency department rate. Other perks are long-standing relationships with your physician that allows them to develop care plans based on your unique needs versus a one-size-fits-all approach. Primary care is built on the basis of an ounce of prevention is worth a pound of cure. Primary care providers are far more likely to place emphasis on prevention when compared to urgent cares. Chronic conditions are also best managed through the guidance of a primary care provider. Too many cooks spoils the broth. 15 unique providers trying to manage your healthcare will lead to contradictory goals and aims. Another advantage to primary care providers is that they are wonderful advocates in the never-ending battle against the insurance companies. Some disadvantages to primary care locations. They often have limited resources on hand, but this may vary greatly by practice. In many locations, they have backed up schedules. This may or may not be an issue. Reach out to your PCP to find out. Offices seldom have the resources to manage emergencies. Generally speaking, they are able to handle a similar acuity as an urgent care. However, pre-booked schedules often impact availability. Now, for the redheaded stepchild of the healthcare industry. Urgent care has its advantages, primarily of which is wonderful availability compared to primary care. Another advantage to urgent care is that, depending on the nature of the ailment, it's often faster than the emergency department. For conditions that are within their scope of practice, it has been my lived experience that they will generally get you in and out inside of 1 to 3 hours, depending on how backed up they are. Often, urgent cares have more equipment available to manage non-crisis situations: nausea, vomiting, diarrhea, upper respiratory infections, derm infections, mild burns and lacerations, even simple fractures. Urgent cares often have better access to ancillary staff, such as x-ray techs and maybe even ultrasound, on hand when compared to the typical primary care office. Some of the drawbacks to urgent care are that appointments are often highly focused around the nature of the illness or injury. Urgent care providers often place little emphasis on prevention of illness or chronic conditions, and they often have a little long-standing relationship with the provider, leading to decreased efficacy managing chronic conditions. Please go see primary care for these issues. In addition, compared to the limitations urgent care has when compared to primary care, they are also less capable to manage true crisis scenarios. When those arise, the emergency department is the answer. So, you're going to the emergency department. The emergency department is appropriate to use when conditions threaten life, limb, or eyesight, or if you believe that the condition is severe enough that it may need a direct hospital admission. Other advantages to the emergency department are that they often have access to comprehensive diagnostic technologies such as X-ray, ultrasound, CT, and MRI. In addition to that, blood work is often able to be quickly resulted. The last advantage I would like to discuss is pretty unique to the United States. Under the Emergency Medical Treatment and Labor Act, or EMTALA, emergency departments are required to evaluate and stabilize any patient with an emergency condition, regardless of their ability to pay. Potentially the biggest downside to the emergency department is that their wide access to diagnostic resources may lead to increased cost for those that are expected to pay on the back end. Now, for what is easily the most frustrating part of interacting with the emergency department. Regardless of when you come in, the conditions being treated are treated with triage in mind. To emergency medicine, a seemingly cool phrase is often held gospel: pain is the patient's problem. While they will do their best to manage your condition, your pain does not affect your level of triage. Conditions such as kidney stones are excruciating and miserable, often do not imply a threat to life, limb, or eyesight, which often leads to excruciatingly long wait times. I hope that this gross oversimplification of the train wreck that is the American healthcare system is helpful to all of you, and I look forward to seeing you in future videos.